Hello and welcome to Health Affairs This Week. I am your host, Jeff Byers. Before we get into today's episode, I wanted to give a quick shout out that we have an insider exclusive event next Tuesday people should be aware of. On August 27th, author Benedict Ippolito will discuss his paper that we released earlier this month. The event is titled Coverage of Anti-Obesity Medicines Could Increase Medicare Spending by Billions, and is exclusive only to Health Affairs Insiders, which is our membership program where you get access to the sharpest minds in health policy through events and newsletters. The paper will appear in the September issue of the Health Affairs Journal, but it's available online to read right now. The paper is open access, but the event is exclusive to insiders. Here today, Senior Editor Ellen Bayer is back on the program. Ellen, welcome.
Thanks so much, Jeff. Happy to be here.
Are you a big social media user, Ellen?
I'm a medium social media user.
Yeah, I kind of think it's all trash, but it still pulls me back in. I don't know about you, but did you notice anything last week on your social feeds?
No, I'm not really sure. No.
Yeah. So you didn't catch up on the latest It Ends With Us gossip?
I don't think so. I'm not sure quite what you're referring to.
It's okay. You're better for it. One thing that did peek through my social feeds, and probably yours as well, is that the Medicare drug price negotiations were released last week, right?
That's right.
Yeah, so last week, Medicare revealed the results of its first drug price negotiation under the IRA. So, Ellen, what were some of the top level findings from this release you can tell us about?
Sure. Thanks, Jeff. Before we get into the details, I just want to point out a few things to put this into context. Before the Inflation Reduction Act, or IRA, was enacted, retail drug prices in Medicare were the result of negotiations among private entities. So Part D plans that administer the Medicare drug benefit would negotiate individually with drug manufacturers to try to get the best price, and some more successfully than others. But the government itself, acting on behalf of all Medicare beneficiaries, previously was prohibited from doing that. So the IRA changed that by giving the Centers for Medicare and Medicaid Services, or CMS, for the first time in history, the ability to negotiate directly with drug manufacturers for a so-called maximum fair price for certain brand name drugs that don't have generic substitutes and account for the largest share of spending in the Medicare Part D program. And in this first year of the program's implementation, CMS chose 10 brand name drugs for negotiation, and more drugs will be added to the program each year. And so the drugs chosen in this round are used to treat common conditions like diabetes, heart failure, kidney disease, colitis, and blood cancers, as well as others. And this new process of government negotiation for Medicare drug prices, together with the other drug-related provisions of the Inflation Reduction Act, are the most far-reaching changes to Medicare since enactment of the Medicare Part D program in 2003.
Great. Thanks for that important context. So really quick to go back to that term, the maximum fair price. That almost sounds a little like it's warranted a definition. So what is that?
Sure. So as I mentioned, before the law was enacted, Part D drug prices were negotiated among private entities, and they often included rebates that drug manufacturers would agree to pay to individual Medicare Part D plans in exchange for favorable placement on the plan's formulary. But for now, for these 10 drugs subject to negotiation, the government negotiated maximum fair prices will be the prices that Part D plans pay. That goes both for standalone prescription drug plans in traditional Medicare and for Medicare Advantage plans. So in its announcement last week, CMS said that on average, the negotiated maximum fair prices in this round are lower than the previous net or post-rebate prices. And if these negotiated maximum prices had been in effect in 2023, they would have saved Medicare a total of $6 billion.
Okay, great. So given that the maximum fair price isn't what consumers actually pay, what do these negotiated drug prices mean for people like you and I, the consumers?
So that's a great question. In the immediate future, Medicare beneficiaries will not see a direct impact of these negotiations because the negotiated maximum fair prices don't go into effect until 2026. But even at that time, whether Medicare beneficiaries pay lower out-of-pocket costs for a given drug that's on this list of 10 will partly depend on whether they pay a flat copayment or coinsurance in their Part D plans. And if they pay coinsurance, in other words, a percentage of the cost, they might see savings. But last week, when the White House announced the prices for the first 10 drugs subject to negotiation, they said that these prices will save Medicare beneficiaries a total of $1.5 billion in out-of-pocket costs in 2026 alone. But it's hard to say how that huge dollar amount will filter down to the individual level to translate into a reduction in any given Medicare beneficiary's out-of-pocket drug costs. But even if this drug price negotiation program doesn't save an individual beneficiary money, the program could improve beneficiaries' access to Part D drugs that are subject to negotiation because Part D plans are required to cover all of the drugs on the list of those with the negotiated maximum fair prices, including all dosage forms and all strengths. And although it's not clear at this point how much the program will affect individual Medicare beneficiaries, other prescription drug provisions of the IRA, like the $35 monthly cap on insulin costs for beneficiaries that went into effect last year, and the $2,000 annual cap on beneficiaries' out-of-pocket prescription drug spending that'll take effect in 2025, will likely have a very noticeable effect on what beneficiaries are paying for prescription drugs. And just wanted to add that the savings to Medicare that are expected to result from this drug price negotiation program are intended to pay for these other consumer-friendly provisions of the IRA. So we really should be thinking of it as a package deal.
So going back to CMS's announcement last week, the word negotiation is in the program name suggests that it's voluntary. Is that correct?
That's right. So the program is voluntary, but if a drug company doesn't want to participate, it will be charged what the law refers to as an excise tax. The excise tax starts at 65% of a product's sales in the U.S., and it increases by 10% every quarter to a maximum 95%. Or, as an alternative to paying the tax, manufacturers could choose to withdraw all of their drugs from the Medicare and Medicaid programs. Of course, given the scale of these programs and how much of drug companies' business they represent, it seems really unlikely that this is something that manufacturers would want to do.
So how's the pharmaceutical industry responded to this program?
Well, not surprisingly, from the outset, the pharmaceutical industry has not been a fan of the program. Far from it, drug manufacturers and their trade associations started filing lawsuits against the government even before the first 10 prescription drugs were chosen for negotiations. Lawsuits were filed by the drug industry's main trade group, the Pharmaceutical Research and Manufacturers Association, or PhRMA, as well as the U.S. Chamber of Commerce and individual drug companies, including Merck, Bristol Myers Squibb, Novo Nordisk, AstraZeneca, and others. And these cases challenge the constitutionality of the program under the First, Fifth, and Eighth Amendments, just to name a few. In these lawsuits and in their public comments about the law, drug manufacturers have been using an argument that they've often made over the years to challenge government regulation of prescription drugs, and that's that the law will chill innovation by reducing drug manufacturers' incentives to develop new and life-saving drugs. So far, none of these pharmaceutical industry lawsuits have been successful, and some of the cases are already being appealed. And we might see more of these cases in the future. And ultimately, the fate of this drug price negotiation program could even be decided by the Supreme Court.
So what have drug companies been saying since the announcement?
Well, there's been some news reporting that drug companies are changing their investment and R&D priorities, but it's really too early to say what the ultimate impact of this program will be. In an article that we published on Health Affairs Forefront earlier this week, Tricia Newman, Juliette Kubanski, and Larry Levitt of KFF said, and I quote, "The negotiated drug prices have a Goldilocks feel. Big enough to achieve meaningful savings, but not so big to drive pharmaceutical companies to pull out of the program or to seriously threaten their profits," close quote. And we'll put a link to that article in the show notes. And Jeff, at the end of the day, this first round is only for a total of 10 drugs produced by different manufacturers, and the pricing is for Medicare only. So the early reports on drug company reactions seem to suggest that they factor the program into their plans and that they're not actually expecting it to have a major impact on their bottom line.
Great. And so what is next as we come to a close with our conversation for the drug price negotiation program?
Well, assuming that the program holds up in court, the next step is basically a process very similar to this round. By February of 2025, CMS will choose the next batch of brand name prescription drugs subject to negotiation. Next time it'll be 15 brand name drugs that account for a high share of Medicare spending. And again, CMS will negotiate the maximum fair price with the manufacturers, and the prices will go into effect in 2027. And there'll be additional rounds of negotiation and new announced maximum fair prices in the years following that.
Well, thanks, Ellen. Is there anything else you want to add or make us aware of?
Well, I did just want to let our listeners know that they can find more information about the Medicare drug price negotiation program in an article that we released ahead of print on August 13th by Health Affairs Senior Editor Laura Tolan. And we'll drop a link to that in the show notes.
Fantastic. Well, thank you, Ellen, for joining us today here on Health Affairs This Week. And thank you, the listener. If you enjoyed this episode, send it to the negotiator in your life, corporate or otherwise. And please subscribe to this podcast and hope you have a great weekend. See you next time.
Thanks so much, Jeff.